Okay, I'm going to be performing my head to toe assessment, starting off with a general survey in which I obtain her vital signs, height, weight. Also, previous to this, I would be assessing cranial nerve number 2 by performing the Snellen chart, which I don't have available. So I'm looking at her overall appearance, how she's kept, how she's dressed, and just overall body symmetry. Also looking at the skin, the visible skin that I'm able to see, making sure that the color is even. As I'm palpating and touching, I'm going to be assessing for warmth or coldness of bilateral extremities and other parts of her body. But just overall looking at her overall appearance. I'm going to be starting with the head. I'm looking at the skin, the characteristics of the skin of the head. I'm looking at the hair distribution. I'm looking at the texture. I'm going to be palpating the scalp. I'm going to be feeling how mobile it is. I'm going to be palpating to feel if I feel any deformities within the skull here. Let me know of any pain or tenderness as I do this, please. I'm going to be palpating the facial bones. Make sure everything feels intact. And again, with my palpation, I'm going to be palpating the ears. I'm going to move on to inspect the sinuses by palpation, and also tell me if you have any pain as I palpate and percuss these sinuses. Open and close your mouth for me too as I assess this joint. Okay. I want you to also open your mouth and stick out your tongue. Move it around back and forth. Okay. And with that, I am assessing. I'm assessing her cranial nerves as she does that, as well as clenching your teeth, squeezing your eyes, wrinkle your forehead. I'm assessing cranial nerves 5 and 7 with that. I'm also going to be assessing her perception of light, sharp and dull touch to her face and then down to her toes. With this, I'm assessing, again, her cranial nerves 5 and 7. So this is sharp, this is dull. I want you to tell me what you feel as you feel it. Sharp, dull, sharp, dull, sharp, sharp, dull, sharp. From there, I'm going to move on to the eyes. I'm assessing the location of the eyes, the symmetry of the eyes. Are you able to take your glasses off for me, please? I'm looking at her iris, her pupils, her conjunctiva. I'm making sure that everything color-wise is appropriate and also even, making sure her tear ducts appear to be intact. There's no oozing or anything like that from them. I'm looking at the distribution of her hair on her face, her eyebrows, her eyelashes. And then I'm also going to assess her pupillary response. Make sure they are reactive, equal, and they accommodate. I'm going to assess her cardinal senses of her gaze. So I want you to follow my finger. Okay. And with that, I am assessing cranial nerve 3, 4, and 6. I'm also going to include in assessing those cranial nerves, I'm going to assess her perception of where she sees my hands. When I move, when you're able to see in your peripheral vision both of my hands, I want you to raise both of your hands in response. So I'm going to come in from the side here. I'm going to come in at a diagonal angle, opposite, and then from up and down. At this time, if I had an ophthalmoscope, I would use my ophthalmoscope again to continue with my eye assessment. So I'm just going to pretend that I have one. I would be checking the brightness of the light here on my hand, and I would be coming in nasally. I would use my ophthalmoscope to come in nasally, go right in front, use my one eye to look into her eye, looking for the red reflex and then also assessing for those arteries and veins located within the eye. I'm going to move on to the ears. I'm going to, again, if I had my tool, I'm going to assess the inside of the ear. I already assessed the outside to see if everything was within normal limits. I'm going to assess the inside by pulling up and back on the ear, going in with my light. I'm looking for the conolite, and then I would also be looking at the tympanic membrane, making sure that it's a nice even color and a nice shine. I'm going to do the Ryan and Weber test to assess for her hearing. So with that, I'm going to be first placing this on top of your head. I want you to tell me if you hear it, and if you hear it evenly through each of your ears, or if you're hearing it more on one side or the other. Okay. And now I'm going to test the conduction between bone and air. So I want you to, I'm going to place this behind your ear. I want you to tell me when you stop hearing it behind your ear, and then I'm going to pull it beside you, and I want you to tell me when you stop hearing it then. Watching the clock. Okay. Okay, with that, I'm assessing cranial nerve number 8. All right, and then from ears, I'm going to move on to the nose, assessing the location of the nose. I'm assessing each side for symmetry. And again, like with the other tests, I would assess bilaterally for the sake of time. I'm just doing one. Assess the nostrils for patency. So if you could occlude one nostril and sniff, do the same with the other, please. And then I'm also going to check her sense of smell, and that would be cranial nerve number 1. So I want you to close your eyes for me. Occlude one nostril, please, and take a sniff. Tell me if you can smell what that smells like.
Sure.
From the nose, I'm going to move on to the mouth. I'm going to inspect her lips. Make sure, again, her mouth and her lips are are even. Inspect the color, inspect the moistness of her mouth. I'm going to use my light to check inside of her mouth, her internal structures. I'm going to be looking at her palate. Go ahead and open for me, please. I'm going to be looking at her dentation. I'm looking at the tongue, making sure it's nice and moist. And then I'm also going to be having her stick out her tongue, assessing her tonsils and her uvula. Go, ah, ah. And with that, through those inspections and swallowing, swallow for me, I'm going to be assessing cranial nerves 9 and 10. With the tongue, I would be assessing cranial nerve number 12 by checking with the movement, which I had noticed earlier as well. I had a movement of the tongue back and forth, up and down, out and in. And from there, you know, again, throughout the inspection, looking for symmetry, looking for uniformity there with the mouth and the characteristics associated with that. Now we move on to the neck and the shoulders. I'm going to be looking at symmetry as far as the shoulders and her shoulder placement goes. Her neck, again, visually inspecting the skin throughout my assessment. I'm going to have her do the shoulder shrug to test cranial nerve number 11. I'm going to palpate the carotid pulses one at a time. And then I'm also going to move down here to her neck, and I'm going to palpate her trachea. Please swallow for me. And I'm going to assess to see if I'm able to feel that thyroid gland. From there, I'm going to palpate the lymph nodes. So we have the submental. We move back to the submandibular. We have the tonsillar, and then occipital. I have the the preauricular and the postauricular. And then I'm going to move down into the superficial cervical chain, the posterior cervical chain, and the supraclavicular. And with that, I'm not able to palpate, I'm not able to feel any masses associated with her lymph nodes. I'm going to listen to her carotid arteries with the valve of my stethoscope. And everything sounds within normal limits. I would do the same for the other side there. Moving on to the upper extremities, I'm going to, again, assess her skin bilaterally. I'm going to assess her range of motion and the strength of her muscles. So you're able to move your arms up and out. You'll be able to move them down. Give me your arms, please. I want you to pull them away and push. I'm going to be assessing her pulses. I'm going to be checking her radial pulses, again, checking bilaterally and comparing. I'm going to test her radial pulse, her brachial pulse. And again, do the same on the other side to test them bilaterally. I'm going to feel for her epitrochlear nodes. Okay, I'm going to then move on to her deep tendon reflexes. So I'm going to test her brachioradial reflex. If you could just kind of relax this arm down. Do not hold it up against me. Turn it outwards for me. Just kind of keep it nice and relaxed. There we go. Movement of the fingers there. I'm going to check her bicep reflex here. Just going to let it hang down. And then also here radially. Okay, and again, I would do the same with the other extremity as well to make sure that they are even. While I'm doing reflexes, I'm just going to assess her patellar reflex, which might be a little difficult sitting so low. Just relax your leg completely. Oh, I got it. And I'm going to assess the other side, again, checking for symmetry. At this point, I'm going to test for the 2-point discrimination. So I'm going to have you close your eyes. I want you to tell me when you are able to differentiate between the point of 2 objects touching you, and tell me when it goes time to you feel only 1. 1 or 2? 2. 1. Okay. With your eyes staying closed, I want you to tell me what number I am drawing in your hand. This is the graphesthesia. Okay. And now I'm going to put an object in your hand, and I want you to tell me if you're able to determine what the object is. Keep your eyes closed. Okay, you can feel it around, do what you need to do to tell me what that is.
Coin.
What, can you tell what kind of coin?
Like a quarter.
Got it. Okay, and from here, I'm going to test motor function. So I want you to put your arms out and be able to touch your nose with each hand. Okay. Now I want you to go from your nose to my finger. Okay, and then I'm going to assess your movement. Tap your hands back and forth on your thighs rapidly. Okay, very good. With that then, I'm going to be moving onto her back and posterior chest. So I'm going to have you kind of turn to the side in this chair here. So I'm inspecting just the symmetry of her back, so how her shoulders, how her scapula is positioned. I'm going to palpate both of those and also palpate her spine the whole way throughout. Do you have any pain with this? No. Any pain over here? No. And again, and under other circumstances, I would have her in a gown and be inspecting her skin. Again, color, evenness, tone, texture of the skin, and warmth as I'm touching. From here, I'm going to take a listen. I'm going to listen to all the lung fields. While she's sitting here, I'm also inspecting and watching her respirations. I'm watching, how if her respirations are even, if they're irregular depth, and how much work she's putting forth in a respiratory sense. Okay. Take a deep breath for me. So I'm going to assess for making sure her diameter is appropriate. We have that 2-to-1 ratio. I'm going to be assessing for tactile firmness. Would you say 99? Out loud.
99. 99.
Okay.
99.
All right. And then at this time, I'm also going to be measuring her diaphragmatic excursion. I want you to take a deep breath in and let it out. Now you're instantly tapping on your back. I'm going to be feeling for the lung bases, and then we'll move on. Sorry, it's a little awkward. So just sit up nice and tall. This is I'm going to be assessing respiratory excursion with this. Expansion was when I had her breathe in. So I'm just going to percuss to feel that lung base. Okay, when I feel like I'm at that base, I'm going to have a little mark here to be aware of where I'm at. I'm going to have you take a deep breath in and hold it for me. Big breath. Okay, and I'm going to measure that space in between where I had percussed. How you can let it out. From there, I'm going to move on to the anterior chest and lungs. Go ahead and move forward for me again. So again, continuing with my general inspection, optimal times she would be, again, in a gown. It would be a little bit easier to assess the skin throughout this assessment. So I'm inspecting for symmetry here as far as the anterior chest goes. Again, inspecting respirations, making sure respirations are nice and even and of a good depth. I'm going to listen to her heart here. I'm using the 8-to-man mnemonic. So I'm going to move down to the second intercostal space here on the right side. And then with this, I'm going to be listening to the aortic area. From there, I'm going to move over laterally, again, the second intercostal space, and I'm going to be listening to the pulmonic area. And this is the area in which you should be able to hear S2 louder, up here at the top. From there, I'm going to move to the third intercostal space, to Erb's point. And then tricuspid, I'm going to move down. We're doing mid-clavicular, fourth intercostal space. And here, down here at the bottom is where I should be hearing S1 better. And then I'm going to move down to the mitral, which is located more under your breast, excuse me. Okay. Okay, after the anterior chest, I'm going to move on to the abdomen. So if you don't mind, I'm going to have you actually lay down here with your phone. Okay, let me just place your up here. So with this, I'm going to start with inspection of the abdomen. I'm going to be inspecting for, looking at the color of the skin again, looking for any pulsations located within the abdomen. After I'm done inspecting it, I'm going to auscultate. Starting down here. And I would be listening for up to 5 minutes in each quadrant for vowel sounds. And while I'm here auscultating, I'm going to be listening to the aortic, renal, and iliac arteries as well. From then I'm going to move on to percussion. So I'm going to percuss the different areas of the abdomen. Okay, and then I'm going to palpate. So I'm going to do some soft palpation. I want you to tell me if you have any pain associated with any of this at any time. And a little bit deeper palpation as I move through the abdomen. I'm going to palpate midline to see if I feel any aortic pulsations. And then also while she's laying down, I would look for her PMI, see if I see any movement with her PMI here in her abdomen. Okay, I'm going to attempt to palpate the liver. So in doing that, I'm going to have you take a deep breath in. Let it out. And I would see if I can find the liver, the border of the liver there. I'm also going to attempt to palpate the femoral arteries here. From there, I'm also going to, after palpating the femoral arteries, I would be palpating for the inguinal lymph nodes, see if I feel any hernias, any masses, any bulges, anything like that. And again, assessing pulses to make sure that they are even bilaterally. So I'm going to move down to her feet. I'm going to be, let me take off your slipper shoes off. And socks. Thank you. All right, again, I'm assessing the lower extremities overall for color, texture, hair distribution, looking at the muscles, making sure that the muscles all appear to be equal and of a normal size. There's no abnormalities in that sense. I'm going to assess the sensation in her big toe. I want you to I'm going to grasp your toe. Let me know if you're able to feel that. Both on both sides. I'm going to have you do that dull and sharp sensation here on your feet and your toes. Close your eyes.
Sharp. Dull.
Okay. We already had done the patellar assessment for her reflexes. So I would also do the Achilles, which I'm going to do when I have her stand back up here, but just to make sure that I make note of that. I'm going to be assessing her pulses as well, again, throughout this assessment. So I'm going to move down here to the PDO pulses and assess them each bilaterally. Go ahead and sit up again for me. Now I want you to run your heel down the shin of your leg. Move it down. And do the same on the other side. Okay. And from there, I'm also going to be assessing the posterior tibial pulse and the popliteal pulse. Go ahead and sit back and just kind of relax your leg for me. And I'd be comparing side to side, make sure that they were intact and even. Again, of note, noting the temperature of her skin and the texture. Go ahead. I want you to kind of sit. We're kind of limited in space here, but sit with your knees up here. I'm going to assess that Achilles reflex. So turn around onto your knees, like this. Up on the couch, though. So, and just kind of let your heel fall, and just let your ankles and your feet nice and relaxed. So I'm going to just assess that. Okay. And then I'm also going to take the bottom of the foot. Sorry. Okay, you can go ahead and sit back down. So while I'm having her do all these movements and motions, I'm assessing her overall ability to move at a musculoskeletal level, making sure that her muscles are working appropriately, that she's able to move from a standing to sitting to lying position easily, making sure she's coordinated and moving well, that movement comes with ease. I'm going to have you stand up for me, and I'm going to assess the spine more thoroughly. I know that I had assessed her backside when I was doing her posterior lungs, but I'm going to check for any signs of scoliosis, and again, checking for making sure everything looks even, that her hips are nice and even, and everything's as it should be. Can you bend forward for me? So with this, again, I'm assessing that spine just a little bit more thoroughly than what I had done earlier. Assessing to make sure that the curvature appears to be correct and alignment appears to be correct and that there's no issues there. And also just watching how her shoulders drop and again, that ease of movement. I'm going to assess how she bends when she does bend forward. So go ahead and bend forward for me. I'm going to have her stand up, kind of bend backwards for me, and then side to side. And again, just assessing the overall range of motion and the movement of that spine. And then to finish up here, I'm going to be just generally testing her overall ability to walk, checking her gait, making sure that everything is intact neurologically. So take a few steps forward for me, turn around, take a few steps back. Okay, and go ahead and sit down. I'm just going to take a quick test, make sure I got everything. Oh, a couple more with movement, I'm sorry. I'm going to have you walk heel to toe, and I'm going to assess how she walks heel to toe. So kind of like if they were making you do a sobriety check. Make sure she's able to do that. Also, are you able to stand on one foot? Okay, and the other. And I'm going to ask you to close your eyes and do the same. Stand on one foot and the other. And with this, as she has her eyes closed, I'm checking for any swaying or any abnormal movements associated with that. So from there, that's my assessment.